This biological clock, how real is it?
The biological clock has everything to do with the quality of your eggs, right? The quality and also the quantity. So basically, laparoscopy means if usually something needs to be removed or repaired, and we don't have to cut like the abdomen or any place open, and you just make little holes. What nobody has taught us in school is that running out of good eggs that actually make you pregnant, it happens earlier.
Good eggs. What do you mean by a good egg?
The merit of embryo freezing is that an embryo is a bit sturdier. It's about 200 cells. So when you have to thaw it at some point, defreeze, it has a better survival rate. It's good to look at the clinic that you want to pick and then check like what is the thaw survival of an embryo? What is the thaw survival of an egg? Everybody can try, but not everybody will have a good outcome.
Welcome back to The Mindset. I'm Dr. Veena, and today I'm joined by a consultant gynecologist who's also a specialist in reproductive medicine. I know what all of you are thinking. It is so hard to get to sit down with a specialist these days with NHS waiting times and all the pressures. So this episode is going to be a goldmine to get some of your commonly fretted questions answered. And I have to say I'm a bit biased in how I feel about her because she's actually been my consultant herself in terms on a personal level. So with a full heart, I'd love to welcome Dr. Sarah Mourik to The Mindset.
Thank you so much. I'm happy to be here.
Welcome. How are you today?
I'm very well. Thank you so much. I'm very excited.
Yes, so excited. There are so many things I want to delve into. But first and foremost, we have to ask, why Obs and Gynae?
Why Obs and Gynae? Are we getting into it straight away?
Straight away.
Let's do it. And you know what? I'm actually really happy to answer this question because maybe for people who are in medicine as well, it's an obvious choice because when you start doing medicine, you know, you have like certain choices. Do I want to be a surgeon? Do I not want to be a surgeon? So that, you know, eliminates certain areas of specialization. But for people who are non-medical, it's like, why do you want to look at vaginas all day? Like, what? And also the question, like, what was the dirtiest thing you ever saw? And I was like, what a weird question. But so for me, it was easy. I wanted to be a surgeon, but I still was looking to have that connection with my patients. And obviously there was the baby part, which when I was younger, I thought was so interesting. So it had a little bit of everything. So it made it the perfect choice for me.
Yeah. That's as honest as it can get, right?
Yeah,
so when
I
was in med school, I narrowed it down by the things I definitely knew I didn't want to do, isn't it? You straight away in your mind, like I don't want to do this, don't want to do this. No. But dermatology had benefits because your patients never really die, right? And then the consultants...
That's true.
Yeah, and the consultants would say you don't get called in the middle of the night.
I was unless it's no night shifts.
Unless it's like a, you know, Stephen Johnson's emergency or something, a syndrome. But it's a safe specialty in that sense.
That's true.
But that's how I had done it. But that's actually good. You enjoy surgery and things.
Yeah, I do.
And you told me personally how you trained in the Netherlands.
I did.
And now obviously you're working in the UK. Is there a big difference in the way?
Huge difference.
Really?
I mean, are we talking medicine or are we talking people? Because
let's start with people and then we'll talk medicine.
I think British people are lovely. Let's start with that. But I think the biggest difference is that Dutch people were very direct and were very blunt. You know, if we don't like something, we're like, oh, that's not good, you know.
I think my mother was Dutch.
Yeah. She might have been. Yeah. Whereas here, everything is like a question, you know. If something is not good, they're like, are you happy with that? You know, and I'm like, yeah. And that's then often not the answer. So I think that's the biggest difference in people. And in terms of like medicine, so in the Netherlands, there's no difference between private care and like public care, or say NHS, how we call it here. So when I came here, I started working in private directly. So it's a whole different mindset whether you work like in NHS or in public or in private. So that was something I had to get used to a little bit. But I'm enjoying it now. Yeah, I do.
And now you work privately?
I do.
Yeah. And what part of that do you really enjoy the most?
I think when you work in private, your patients have really high expectations. I think every patient obviously does. When you go to NHS, you do as well. But when you go to private, you choose that because you're looking for something, I think you feel like you couldn't get in public.
Yeah.
So the expectations are higher. Plus, in private, you have the freedom to individualize your care.
Yeah.
Like in public, and I'm not sure if that's in NHS because I've not worked in NHS, you're very bound to protocols,
Yeah.
evidence-based medicine, and usually that applies to larger groups of people.
Yeah.
Because now this evidence comes from research that has
Yeah.
been done on large groups of people. But an individual doesn't necessarily fit a certain group. So when you're in private, even though you hold on to those guidelines, there's more freedom to individualize and with that try to meet the expectations of your patient. So I think
Yeah.
that's one. And the other thing is that besides medicine, you learn how it is to run a business.
Yes.
It's as honest as it gets.
Yeah, that's really true, isn't it?
Yeah, it is.
What would be the downsides of working privately?
Or I think you're more exposed because as a doctor, if something goes wrong, it's you. You did it. It's not like, oh, this is just the system, or no, I came to you and this is not what I hoped I would get from this. So I'm always very aware of that when I work.
Yeah, that's when you put it like that, that's true, isn't it? It's
Yeah.
that responsibility is just
Yeah.
there. Okay, so we know why obs and gynae.
Yes.
And you said like people ask you the questions of what's the dirtiest or the grossest things you've seen.
Sorry,
and
you're gonna ask me.
No, but I feel
good.
like these conversations are always around dinner tables or
Yeah.
when you're about to eat and they're like, oh, so what have
Absolutely.
what have you seen at work?
Yeah.
That's like horrible. And
Yeah.
I always look at my friends and think, firstly, why would I tell you this right now? In a social setting, how have I
Yeah.
become the class clown
At the dinner table.
to share these stories? But I guess it probably comes from a place of intrigue, right?
I think so. And maybe, people watch television, so they sort of extrapolate what they see on television, and they think we're in Grey's Anatomy,
Yeah.
when obviously we're not. So, yeah, I think it's interest and a bit of sensation, maybe.
Yeah, and I do believe that patients really share so much with us, right? In terms of their
Absolutely.
personal lives, their
They do.
choices, and what we were saying earlier. It's so interesting to learn what drives people and what
Yeah.
motivates them to even do different things.
Yes.
And I don't know if you agree, but even as a GP, one of the biggest lessons I've taken of the years I've worked is most people just want to be heard
Yes, they
or
do.
feel like they've been listened to, and that's half the battle won,
Yes.
isn't it?
It is. They want honesty, and they really come to you at their most vulnerable. So they're relying on you to
Yeah.
help them. That's I think that's like the basic answer when people say, "Why did you become a doctor?" I want to help people.
Yeah.
But it has a big truth in it.
Yeah, no,
Yeah.
absolutely.
Yeah.
Okay, you're in this competitive field, and especially working privately as well. There's all these pressures on you. If there was someone who is in medicine and looking to enter that specialty, is there any advice you could give them?
I think when you make the decision of what you're going to do, like with the rest of your career or like with the rest of your life, if you will, you're still quite young.
Yeah.
When I had to make the decision what kind of specialist I wanted to be, I had no idea what life with a family, with kids, like when you're older, it's sort of hard. Like I wanted to do obs and gynae because I thought it was awesome. And then people said, "Are you really sure?" Because, night shifts and this, and it's really like stressful. And if you look at different specialties, like obs and gynae is right there in terms of how stressful
Yeah.
and taxing it can be. And you don't think about that. You just think, oh, I like it, so I do it. So I think for people who are considering to do obs and gynae, think about where do you picture yourself in 10 years? Do you want to still do night shifts? Do you like to teach people? Are you good in acute moments? Are you well under pressure? These are all things that are very much sort of attached to being in obs and gynae. So if you are listening and you think, yes, that's me, well, then do it.
Yeah.
And if you like something so much, you will always make it work. So
That's true.
I think it's also a bit of a gut feeling,
Yeah.
like this is for me.
So if someone wasn't great at those things now, working making acute decisions,
Yeah.
which is emergency decisions, or wasn't great at night shifts. Is that a skill that could be built upon?
I'm not sure, you know, because for me that was always something that came natural.
Right.
But I've seen people who went through their whole training. So, you know, 6 years becoming a doctor, then 6 years of becoming an obs and gynae, and then they were done. They were consultants, and then at that point, it's all you, and you don't have that safety net of your, you know, of your boss anymore, and the responsibility is all you, and they couldn't do it.
Really?
Yeah, and they stopped, you know, and they are doing something else now. So I'm not sure. I'm not saying you can't build this skill. I'm just saying I think it's a really difficult skill to learn if it's not something that comes naturally, and it's just what kind of character you are.
So true, isn't it? And you don't know unless you're put in that situation either.
So that's why we have rotations, right?
Yeah.
So you can sort of test it, see if this is something you like.
Yeah. For you personally, Sarah, you know, having said that, what has been the most challenging part of your training or your career so far, would you say?
I mean, that's such a good question, and I could say so many things. But I think if you would have asked me this question like 6 years ago when I was in the middle of my training, the answer would have been so different. But right now, I feel like the most challenging part is when you make decisions, like make them because you're making them for you, because it's good for you, because it gives you life, it gives you energy. You know, it's so easy, and you must know this, that when you're sort of on this train, there's always a next step that seems sort of logical, and it's so hectic. You're like,
yeah,
you know, and
before, exam.
Yeah, and before you know it, you're like doing something. You're like, how did I get here? You know, so I think, I mean, and that doesn't just apply to medicine or career. And I always think like, okay, let's take a moment and what's really important, what do I really like? But obviously there's also the other examples from doing night shift when you were younger, and there's acute situations, but your boss is not here. Like, am I calling him out of his bed? Am I not? So, I mean, it's just, what kind of answer you're looking for in this?
Yeah, so those were the challenging things.
Yeah.
Okay. And if you were to look back at the start of your training, like now knowing everything you do, would you have done anything differently in the way you went about your training?
No.
Okay.
No, I don't think so. I mean, I went in head first. You know, it was a gut feeling. I loved it. And it worked out.
Yeah, and I think that would really encourage people, knowing that however hard the journey is, however long the years are, when you reach that final position, it's actually worth it. So that's really good.
I do think so. And the journey was amazing. Even, you know, obs and gynae is like a really broad specialty. You know, it goes from oncology, so like cancer treatment, to babies. Like how broad do you want it?
Yeah.
So a lot of those things I don't do anymore, because, you know, you specialize and you get more and more narrow in what you're doing. But sometimes I think, and I thought, well, I did do that, you know. It was beautiful, and it taught me so much. And so it's worth it in the end, but while you're doing it, it's pretty cool as well.
No, it really is. I remember delivering my first baby and thinking,
right? You did
wow,
that. Even
what is
you don't
happening?
do that anymore. That is just
miraculous. Just having your hands in another human being's abdomen, and you're just like, what is this? This is magic. Yes. Absolutely.
You're like, this is so cool.
It does feel really cool. I agree.
Yeah.
Was there anything specific that inclined you towards reproductive health?
Yes, there was. I mean, so you become a gynecologist, and then you sort of have to think about what kind of gynecologist. And for a very long time, I wasn't sure whether I wanted to do obstetrics, so delivery room, babies, or reproductive. And in the end, I picked reproductive because for me, it was more challenging. I still wanted to do some surgery. And in reproductive, you can do laparoscopy or hysteroscopy. And there is the whole study of endocrinology, so hormones. So I thought it was more challenging, and it would give me sort of more satisfaction in the long run.
Yeah.
But I do miss the delivery room.
Yeah.
Sometimes I feel like,
action,
maybe I should do just like one shift.
One shift here and
catch
there.
some babies, because it's just amazing.
Yeah. Okay. For those listening in, if you could simplify it, laparoscopy, hysteroscopy. So these are keyhole surgeries, but Dr. Sarah will tell us.
Exactly. Yeah. So basically, laparoscopy means if usually something needs to be removed or repaired, and we don't have to cut like the abdomen or any place open, and you just make little holes and you watch with a camera. So that's laparoscopy, and hysteroscopy is a tiny camera that goes through the vagina inside the uterus to remove polyps or fibroids or anything that might be there that shouldn't be there.
Yeah, perfect.
Anyone,
so we don't just sit here doing medical jargon because I get told off for sometimes.
No, sorry.
no, don't be. Great. So I had done a Q&A on my Instagram to ask people, what would you like to ask someone who specializes in this field, right?
Yes.
And I've had some great questions.
All right,
right?
let's do it.
Because I think a lot of debunking, demystifying some of the stuff is also important.
Yeah.
These days, I think everyone is an expert on the internet.
Absolutely.
And I think it's really important to check what everyone's qualifications are before you listen to their unsolicited advice. I really think it's important because I don't know about you, but I've had patients come in with things they have tried on their own bodies. Sarah, I had a patient who was using coconut oil on her cervix because she watched a video where it said that would prevent cervical cancer. And I
you know what? I don't think it would harm the cervix, but it's just not the first thing.
But I think she was using a very long probe and it kept poking and she ended up with pelvic inflammatory disease and really poorly. But it's just
so
the internet.
We need to talk about these things. Yes.
So unsolicited things. Okay, perfect. So to start with, fertility it's such a big topic in general, right? So if we home in on the hot topic now, which is everywhere, managing, controlling your fertility, egg freezing.
Yes.
As a woman who's gone through it myself, I know all the questions that go through your mind, what will others think, the pressures, is this something I want, is it, the biological clock and all of this. Let's start with something a bit broad. This biological clock, how real is it?
It's very real. It's very real. So to jump right into it without sounding like a biology teacher, the biological clock has everything to do with the quality of your eggs, right? The quality and also the quantity. So egg freezing, it's a hot topic. You see it in the media. Celebrities are speaking out about it. But it becomes more of a thing that people discuss with each other. So the biological clock just means running out of eggs. But more it means running out of good eggs. Because that happens a lot earlier than running out of eggs. So this is exactly the gap in knowledge I feel under women, because running out of eggs is when you become menopausal. That basically means there's no more eggs. So when women turn 40, they're like, I'm almost 50, I can see menopause like in the distance. Like, where am I? What's the deal with my eggs? But what nobody has taught us in school is that running out of good eggs that actually make you pregnant, it happens earlier. So people do get more aware, but I do feel that is like almost like the revolution that's taking place now, that women start to understand their bodies and their fertility better. So it's a real thing.
It's a real thing. Yep. Agreed. Absolutely. And this clock obviously ticks faster when you're entering your 30s, and you might have certain career pressures, personal life pressures, and then obviously conceiving in family. When you say good eggs, what do you mean by a good egg?
A good egg. So a good egg is an egg that gets fertilized and then divides into a healthy embryo that then grows into a healthy baby and gives you a live birth to, talk medical again.
So when we talk about the quality of an egg, we're talking about the quality of the DNA?
Yeah, the genetics, basically.
Yeah. And that's what we want to try and do as early as possible, isn't it?
Well, you mean the younger you are? Yeah, exactly. So basically, the younger you are, the better your eggs. And like in general, your eggs would be of good quality until more or less 35. Then between 35 and 40, it becomes more average. And then after 40, it plummets actually quite quickly.
Yeah.
So.
Okay. Yep. That was straight away going into it.
I was going to say, this is basically the key thing.
And I think, I don't know, I know it's a big topic and it might, I hope it doesn't upset anybody, but it's important to talk about it
It
because
is.
we have to normalize it. It happens to us. We can't be hush about it anymore, I don't think.
Exactly. No, I absolutely agree.
Yeah. Okay, so that's what that is. Can anyone do it?
Yeah, so I think, you know what? I think the honest answer is no. And the thing is, I think everybody can try,
Yeah.
but not everybody will have a good outcome. And I think I can't sort of generalize and say everybody that's this will have a good outcome and everybody's that, because not everybody's the same. So you really, I mean, I can make generalizations, you know, obviously, like I said, the younger you are, usually the better your eggs. But so that's why I would encourage everybody that's watching this podcast to have an MOT, you know, look into your individual, your personal situation. So you can then make an informed decision about your fertility, because really the worst thing is people that come eventually because they've been walking around like, shall I have a look at it? Shall I not have a look at it? And then you come eventually and then maybe the decision has been made for you by biology.
Yes.
Right? So even you think like, oh, I might be young, have a look. You don't have to do anything. It's just self-care. You know, look into who you are, what you have, and then you can make a decision.
That's such a nice way of putting it, actually. The same
think
way
so.
you'd want to do a routine blood test to check your sugar and cholesterol.
Yes.
As a woman, to just check your fertility is also something you should actually look at.
Absolutely.
As self-care. That's a very good point. And you know what, I loved what you said about the individuality of each of us, because I even remember hearing so many stories from others about when you're doing the injection process of the egg freezing. You know, the things I heard was you'd gain weight, you'd have mood swings, you would be exhausted, you can't do anything, and the pain is unbearable. And after having gone through the process, I felt like I was lied to. I had the best time.
What do you think about it?
So my personal experience was maybe an anomaly, maybe a small percentage, but I had a lot of energy. I was still training and teaching, and I was recording podcasts. I think just 1 or 2 days before the procedure and after, I was a bit exhausted, but it was nothing compared to what I was told before. And although I have all this knowledge, that fear was still there. Or what if this happens, that happens? And after that, now I openly tell every woman, we're all so unique. Each of our bodies respond so differently. Yes, someone may have had a certain experience, and take that on board, but you never know what your experience is going to be, isn't it?
No, that's absolutely true.
Yeah.
And again, like, media plays a big role, right? Because if you see a movie, somebody going through IVF, it's always like, or the egg freezing, it's always very like, oh, this is horrible.
Yeah.
But actually, lots of my patients, they're like you.
Yeah.
And obviously, there are patients as well that find it hard because they have symptoms, or maybe they find it hard mentally or emotionally.
Yeah,
you know,
yeah.
like who grows up thinking, you know what I really want to do? Freeze my eggs, you know?
Yeah.
Not really. So you know, but it can also feel really empowering.
Yeah, no, absolutely. And I think having that thought and just being prepared before you go into it is really important as well. So that's really useful.
Yeah.
So when someone, say they go to their doctor, they speak to them about the blood test they need to do, they do an MOT, and egg freezing obviously is not available on the NHS, so they'd have to then shop around and find a private provider, and each person is unique, right? But if we had to just sum up the process of what it does, when someone says egg freezing, what actually happens?
What happens when you freeze eggs?
Yeah.
So in a nutshell, you come for an MOT, right? We have to assess you. Like, who are you? Are you healthy? How many eggs do you have, more or less? What's the quality of these eggs? So we have to assess. Then you get informed, like, so this is who you are. This is what you can expect, you know, and then you decide whether or not egg freezing is for you. And then when the process actually starts, you have like a period of 10 to 12 days of injective medication.
Yeah.
No scary needles, small needles, like diabetic medication or like an EpiPen, you know?
Yeah.
So 10 to 12 days. And during that period, you have a couple of scans, usually around 3, maybe 2. And then you have an egg collection, which is basically like a pelvic scan, so an internal scan, but then with a needle on top that we prick in your ovaries. That sounds scary, I know, but it is really not that bad.
Yeah.
I mean, you maybe can tell what you thought about it. So the whole thing is about 2 weeks.
Yeah, that's the process. And then afterwards, can they just be stored for life?
Yeah, so that's a really good question. In the UK, the law currently is that you can store them for 55 years, but that's quite new, because about 2 years ago, maybe even a year and a half ago, that was only 10 years.
Wow.
So that limited egg freezing a lot.
Yeah.
Because if you want to freeze when your eggs are good, like in your begin 30s, then you could only freeze them until begin 40s. Basically, when you want to start using them, you couldn't store them anymore.
Yeah.
But that has now changed. So that like opens the door to a better narrative, I think, in the UK at least, for egg freezing.
Okay. And so this is in terms of obviously women.
Yeah.
But in terms of a man, say they're watching or they're listening in and they want to support their partner or think, can I do something equivalent in terms of my sperm? I've had patients even ask me, what can I do? And I've always said to them, well, the thing with you is you don't have to worry.
You know what's really funny? And so I have a colleague, and he's a man. And he was actually talking about, like, he wanted to do it. And we were
Like freeze his sperm?
He wanted to freeze his sperm. And we were like with a group of women. And in retrospect, but we were all like, why? Like your sperm is fine and it's not age dependent like our eggs. But you know what? Why not?
Yeah.
But it's not as pressing or like as needed as for women. But if you want to freeze your sperm, I mean, what I learned from that is that, who freeze sperm, for instance, soldiers or people at risk of losing, or, some men are born with only, they have 2 testicles, but one has to be removed for medical reasons. So if you only have 1 testicle left, I understand you freeze sperm, because what if you, lose the other one? So there are definitely reasons why you should or could freeze sperm, but like for social reasons or electively just, because you get older, that is not really a thing for men.
Yeah.
Although I'm saying that now, maybe in 5 years from now, because male fertility is actually really researched at the moment. So maybe in 5 years from now, we'll find something out and say, no, DNA fragmentation. So who knows?
Yeah.
We'll see.
Okay.
Yeah.
Amazing. So we talked about there'd be the injections that stimulate the ovaries. And once the eggs are ready, that there's a collection and then we can store them depending on how many years, that happens.
Exactly.
Now, you can store eggs, and I also know you can store embryos.
Yes.
So that happens, is that the same kind of process with injections? And
And this is a question I get every time, because if you go on the internet, you'll see maybe you should freeze embryos instead of eggs. So basically, the process is the same. You stimulate the ovary, and then you have an egg collection. And with egg freezing, that's where you freeze. So if you do embryo freezing, same thing, take out the eggs, but then you fertilize the eggs, and then you culture them for 5 days until they reach a stage, which we call blastocyst stage, and then you can freeze an embryo. So the merit of embryo freezing is that an embryo is a bit sturdier. It's about 200 cells. So when you have to thaw it at some point, defreeze, it has a better survival rate, right? So whenever you think about doing this, it's good to look at the clinic that you want to pick and then check, like, what is the thaw survival of an embryo? What is the thaw survival of an egg? That's a very important thing to look at. But then obviously, once your egg is fertilized, you can't fertilize it with, if you're single, then I'm freezing, you'd need a donor.
Yeah.
Which is also, it happens.
Yeah.
But I'm lucky enough. I work in a clinic with really good lab. So our survival rates of eggs are really good. So I'm always pretty confident in advising egg freezing. Yeah. But yeah, there are other clinics that say, better to freeze an embryo.
Yeah. And I remember you explaining that to me as well, the survival rates, because that's important. Yes, this looks like a great option, freeze your eggs, but it's not 100%.
No, never 100%.
No. And the numbers are quite drastic as well, aren't they, in terms of survival rates? So could you give us just maybe like a headline for someone to understand?
Yeah, absolutely. So so this is first, I want to sort of say something about egg freezing in the press, right? Because although we have some positive stories recently about people, coming out that they froze their eggs when it just came out. And for instance, big companies like Facebook or Apple offered it as a benefit. People were like, no, people are getting pressured into freezing their eggs. The negative headlines say egg freezing is false hope. It's not 100%, but it is true, and I tell my patients that it's a numbers game, right? You freeze a certain number of eggs. Then you have to, when you start using them, you have to thaw them. Then you'll lose a few because of the thaw survival. Then you have to fertilize them. Not every egg will fertilize. Then you have to culture them from day 1 to day 5. Not every embryo will make it from day 1 to day 5, right? And then the ones that do, they have a certain success rate of getting you pregnant. And that success rate depends on the age that you froze them, right? Egg quality, the younger you are, your embryo eventually, the higher your success rate. It gets very mathematical right now.
And that's why the quality of your egg matters.
And that's why the quality of your egg matters. That's why your age matters.
Yeah.
So when you have an MOT, we'll go over the math together, right? Because there are algorithms actually at the moment that say if you're this age, you should freeze this number of eggs to have a realistic chance of having a baby in the future. So that's what we say, a realistic chance, right? And is never 100%, but neither is it when you have a partner and you start trying for a baby at home.
Absolutely.
Like, you never know.
Yeah, no, thank you so much for sharing that because it's important to understand that as well. Because there's so much to deal with as a woman, right? The one thing you get the courage, go do the process, but still not 100% understanding all this. And then you say a prayer and just hope for the best. What do you do,
Fingers
right?
crossed.
Yeah. So, okay, great. And there are some easier ones, not as heavier questions. Are there any lifestyle changes or precautions someone should take when they're going through the process?
Yeah, also a question I get all the time. So there is, if you Google, you find so many things, diet, exercise, massages, fertility massages, they exist,
But what are they massaging?
I don't know. Okay. To be honest.
Fine.
The thing is, like, nothing of this is evidence-based. No. So you can't say, if you do that, it will be better, right? So I always say, the basics, get enough sleep, get exercise, healthy diet, no smoking, no drinking. That being said, some people are in a fertility trajectory and it takes years. And then sometimes I get the question, my sister is getting married. Can I drink a glass of wine? And I'm like, yes, of course. Right? Because otherwise it becomes so stressful and it becomes so big. It dictates your whole life. Yeah. So my answer is just be the best, be healthy, but within...
Yeah, and I think when you're saying with the injections, as you're taking them, avoid heavy contact sports and physical activity that could kind of impact your pelvis and hips and things like that. Yeah,
just be mindful of yourself.
Of what you have to do.
But that's also different for everybody.
Yeah,
Yeah.
Great. The recommended age, as we said, the younger the better.
Yes,
ideally. Are there any potential risks for the person carrying out the procedure?
So. For the person who undergoes egg freezing.
Undergoes it, sorry, yeah.
I mean, there are always risks. Every medical procedure, like even extracting a toenail.
Yeah.
but the risks are really minimal, right? So the medication has side effects because it's hormonal. Yeah. Basically, when you start injecting, you'll have multiple eggs growing instead of just one, which naturally happens. And all these follicles that contain an egg, they produce estrogen. So you can have side effects. You can feel bloated, you feel tired, maybe a bit more on edge. Like it's different for everybody, but like you feel a bit how you feel just before period, potentially. So I think the side effects of the medication, and then during egg collection, the procedure involves a needle. Every procedure that involves a needle has a risk of infection, bleeding. You know this.
Yeah.
And lastly would be hyperstimulation syndrome. So for people that have a lot of eggs, and then we stimulate, so all these eggs grow. And then we collect the eggs. So you can imagine there are like huge hormonal shifts when you do this. And sometimes that leads to a condition which we call hyperstimulation syndrome. in which you feel unwell, you feel very bloated. Usually it's mild, and you just drink a lot of water and take some time, and it will subside.
Yeah.
Sometimes you'd have to go to the hospital to get water through an IV.
Yeah.
But this is like very rare at the moment.
Yeah.
But it does happen.
Yeah.
Yeah.
And I think a last common one, if someone does one cycle and say they get a certain number of eggs, can they do another one?
Yes. Actually, very often people have to do multiple cycles. As I said before, egg freezing is a numbers game.
It's never an exact science, is it?
It's never an exact science. And usually the more eggs in storage, the better. Because obviously, like I said, you start using them, numbers go down. So the more eggs, the more embryos eventually.
Yeah.
But even for the minimal number of eggs that we would recommend for a certain age, it's very likely that you'd have to undergo 1, 2, 3. I would say average is 3.
Average is 3. Okay.
Yeah, rounds of egg freezing to get that number in storage.
Yeah.
So then the question I always get, like, is this going to affect my future fertility? Like, if I do this, are my chances of conceiving naturally in the future, are they lower? And the answer in a nutshell is no.
Okay.
They're not.
Yeah. No, thank you. That was amazing. There's so many questions, guys. I hope that's kind of debunked some things for people who may not have understood this at all. So thank you so much for sharing your knowledge with us. To break up the topics a little bit.
Yes.
Going back to the woman behind the consultant, right? Such a high stressful job. And you said you recently had a baby as well. Congratulations.
Thank you so much. Well, she's 8 months
She's
now.
8 months, yeah.
Yeah.
And what's it like balancing that hat and then being in a work environment where you're maybe seeing people struggle to conceive and get to that point?
Yeah, I mean, being a mom is lovely. I love it. It's hard to try to combine your career with your family. But also the weird thing was I work in a fertility clinic. So when I was pregnant, my patients are trying to get pregnant. So that was sometimes sort of uncomfortable. But the funny thing is that I actually found, where I was sort of trying to hide it sometimes, people are like, "Are you pregnant?" and it just sort of gives hope.
Yeah.
Like in a weird way, the reactions were very nice and very positive. So that was it was an experience. I mean, I think as a gynecologist, when you become pregnant, right? You undergo the thing that you do deliveries or you make people. So you do the thing
bread and
that
butter
you
becomes the bread and butter.
You become the thing that you do, which is, and I always thought that because I know the theory, I would be really good at it.
Yeah.
But I sort of, it sort of wasn't. I had all the sickness, all the things, and but it I think it made me a better doctor. And I know that sounds like super cliche, but it really did, right? For if I can give one example, miscarriage, right? It's the thing that you see on a daily basis. It's so common.
Yeah.
It happens. You see people, you empathize, you help them.
Yeah.
But only when I became pregnant myself, and I was around that point, 8 weeks.
Yeah.
I thought, what if I miscarry now? That is, you're super sick and you blah and you're full of emotions, and you don't understand that until you go through it. So I thought it was really special becoming the bread and butter. I really learned from it,
No, I think that's very well put. And most things, even in medicine, like you said, we're taught what to say, how to say, and you do it. You might do a great job,
right?
But it's not unless you have a lived experience of it do you really appreciate.
Absolutely.
I remember, not on the same scale at all, but having my first urine infection years ago. And really understanding the term dysuria and urgency. And I was like, wow, this is really painful. So when patients now come and they describe this, I not that I never understood before, but you have a different understanding.
It changes.
It changes.
Absolutely.
Yeah, and I think same, I guess we wouldn't be sitting across here if I hadn't gone through my journey and gone through this whole process to really feel passionate about sharing that knowledge and telling people that it's not something you should really be scared of.
Yeah, no, I think it's amazing that you're doing this, because it is a topic that should be, this should be the topic at the dinner table, right? So not like what horrible things, what do you think people should know? And I really think this is one of them.
Yeah, and I have to say, I don't know if you remember, but you were so pivotal in making me feel confident about the choice. I think your words were, Veena, it's going to take the pressure off. Because you asked me, are you married? Are you single? What's your situation? And I shared it with you and you were like, it's just going to take the pressure off.
It does.
And I know those were just words, but after having the procedure done, you're right, it takes the pressure off.
Yeah.
And you can just kind of focus a bit on life and do things. And I'd want to encourage any woman listening today, if this is something you're thinking about, you should definitely reach out and read up a bit more about it and, speak to some experts before you decide either way, isn't it? How do you personally relax and what do you do to unwind from work?
God, you know what? At this point, because I actually have 2 kids. I have one daughter of 2.5 and one of 8 months. So relaxing at this point is almost going to work. I know that sounds really weird, but it's just, my kids are amazing, right? But you're like always on.
When someone says relaxing is just go to work, that says it all.
I'm sorry.
You're being honest.
No, it's but what I do, what do I do for, you know what I have to think about? You said yourself that you love to dance. For me, I would say dancing.
Really?
Because I dance like bachata is like my main thing.
Wow.
Kizomba, a little bit of salsa. So dancing, right? Isn't there nothing better than just the freedom when you dance?
Yeah.
So I would say dancing.
Amazing. And, we opened the conversation going straight into why obs and gynae.
Yeah.
So obstetrics, gynecology. With all the pressures and the way you'd worked, now coming towards the end of our interview, I'm just intrigued to know, were you well supported through the entire journey, be it with family or people around you?
I was. I had my, in the beginning, it's your family. And right now it's my amazing husband. He's really, you need that, especially, we have these kids now and he's basically taking care of the kids. That's his support.
Yeah.
He's literally there. And then he's, when I come home and I need to, get off my chest what I saw that day or what he's there. And so, and I think for every doctor or basically everybody who is in a job that is taxing, you need that support. So I've been lucky to have that throughout the whole journey, basically.
Yeah, great. So I think anyone listening in today, if you haven't been inspired to enter obs and gynae or enter fertility training or even open your thoughts a bit more about what to do if you're thinking about egg freezing, I'm sure after this conversation you would have had some ideas.
Yes, I hope so.
Yeah. I wanted to ask you something. Last year I went to Wired Health, the conference, and there was a specific topic raised. There was research being done at trying to identify the protein that starts the menopausal changes in women. There were talks about in our lifetime we might see something being developed where we can stop the menopause or / pause it, which means the biological clock won't be a thing anymore. Have you heard about any of this work or?
Obviously this is the holy grail, right? Because I get this question all the time, like, what can I do to improve my egg quality? It basically, in a sense, is the same question. How do we stop aging? And I think there's multiple theories. And I've heard some talks that I thought, this is it, right? But everything is like in experimental phase still. But that's one of the reasons why I'm so happy I chose reproductive medicine, because I do think, and I'm not sure if we're going to be around, to really see that, because it's absolutely in the absolute beginning stages. But I do think that we're working.
I do too.
Yeah.
I think they'd have to prolong life. Yeah, delay or prolong life in general, because otherwise, can you imagine having a child at 60 or 70, and if your life expectancy is still 85, that wouldn't be fair on the kid.
No, exactly.
Yeah.
No, that absolutely.
Yeah, so I heard about that.
know.
But it's exciting times, isn't it, in that field?
It is. I mean, yeah, so that like delaying aging, delaying menopause, uterus transplantation, you know, it's I mean, right now the thing that is very much happening is storing tissue from your ovaries. Like obviously this happens for younger women with cancer. They take out an ovary or a piece of the ovary, they freeze it, and then after cancer treatment put it back. Wow. And it starts functioning again. Wow. Yeah, like it's amazing what they yeah.
It is. That's amazing. Yeah. Okay, great. So to end with, I would love to just ask you, for someone who's, you know, you've given us advice of if someone's looking to explore this career, just so we can kind of get a glimpse into what it's like being a consultant gynecologist working privately.
Yeah.
Can you talk us through what your week looks like?
Yeah, absolutely. I mean, if you think about getting into obs and gynae, like my week, what it looks like now is not what you're gonna get. Like so now it just looks like pretty much office times,
right?
You know, so I start between 8 and 8:30, and then you work until 5:30ish. I do. I see patients. I do consultations. I do scans. I do egg collections, embryo transfer. I do some minor surgery. Luckily, my hysteroscopy. So that's that basically, and then I have like 1 or 2 weekends that I have to work as well. But this is relaxed, right? I think for a gynecologist in NHS, you work like when I went back to when I was sort of in NHS, but then in the Netherlands, your days are from 8 to 6 if it's a normal day. So
if you're not on call or if
yeah,
you're on
so
surgery,
like a normal working day is 10 hours, and then you have your night shifts and your late shifts and your like. That is a completely different world, which at that point I loved. But as you get older, like even night shifts, they take their toll, you know, like it gets harder and harder to get up in the middle of the night. And so yeah, it is what you pick, right? So that's
what you like put into, And it's interesting what you said about shift work, because obviously there are studies that show your mortality does increase with the amount of shift work you do. And I used to always think of shift work with medical workers, but one of my friends actually recently pointed out to me, she's a banker, she works in the tech banking world, and she was like, you know, we do shift work too.
I was going to say bankers do shifts?
No, but if they're based in one country and their office is, say, in America, they'd have to be up at 2 a.m. or 6 a.m. I mean, you know, throughout the night for their meetings and calls. And that was like, oh my God, that's so true. She was like, yeah, when we're on certain projects and you're working with a different country, you're working those hours. So we do shift work too. And I was like, that's actually a very good point. Then I told her, your mortality is affected too, not just us.
But this is why I love so much, like talking to people that do something different than you do, because that's so interesting. I had no idea.
Yeah. Amazing. Sarah, when we normally tie things up at the end, I ask my guests if there's one thing you want to ask me. Is there anything you'd like to ask?
Hi, you should have said this before, because then I would have, you know, come up with a really good question. Give me a moment. You know what? You're a GP, right? So what's the best thing about being a GP?
There are loads of things. But for me, I think the best thing has to be being a generalist.
Yes.
Yeah, I love being a generalist, having a bit of knowledge about a lot of different systems, a lot of different physiologies and anatomy, and just understanding how most things work in the human body. I think that really excites me. I think that tied with seeing a patient from poor health to good health, when you see that improvement and they come and tell you, oh, I did that and I'm better now, that's like one of the best feelings, because you know, you trust your own judgment a bit more, and it's such a deep sense of fulfillment. I think that the stories beyond that, but I think being a generalist part, because there's so much to learn, there's so much, and even with that you can subspecialize and do things, but just generally when you first qualify, like you said, you're suddenly, all the decisions are on you. That being a generalist part, I think, is very empowering.
And do you feel like, because it's family medicine, right? So I always think like when you're a GP, you see what happens in communities and within families. Is that something you find as well?
The trust is immense,
Yeah.
especially now that I've worked as a GP for a few years. You see the same families, you're seeing their children and their
Exactly.
relatives, and they come to you and you're seeing the community build, to the point where they'll come and say, I have my Filipino patient saying, oh, we made pancit at home, we wanted to drop you some, or we're making
Exactly.
biryani next week, we're leaving it at reception for you. And you become a part of their extended family.
Yeah.
So that's beautiful, and that trust is there. But you have to build it. It's hard because continuity of care is difficult if you're not always in the same clinic and seeing the same patients.
that's
But
true.
once it's there, it's beautiful because they really trust you, and what they may not have done once, if you can convince them to make better choices for their health, it's not just the patient you've impacted, it's generations that come afterwards.
Yeah, exactly.
Because that information will then
give it through. Exactly.
that information will go down as domino effects. So I think, we may just be seeing that one patient at a time in 10 minutes, but if you do it the right way, I think the impact is honestly, it
really
knows no
big.
bounds. Yeah, I think so. I think so.
I think so too.
Yeah.
I think it's wonderful.
Yeah, but guys, if you would like to ask us any questions from what you've seen today, be it about life, be it about balancing your family life and career, the career itself, or fertility, egg freezing. We've obviously just scratched the surface in this episode, but if there are a lot of questions, we should definitely do a part 2 where we can home in on certain things. I'll leave our contacts below where you can write to Dr. Sarah or you can reach me. Thank you so much for tuning in, Sarah. It's been such a pleasure. Thank you.